We must put in place things that attract you guys to stay. As students, medicine and healthcare work will be one of them. We must put in place a system that helps your parents afford your education, or that helps you afford your training. So we look at it, and I promise we'll do something about it. It's important. The ratio of medical workers to the population is too low. So we'll subsidize and we'll work on it, but I promise you, we'll do something about it. If you recall when I talked about my own pet project, when I was on the board of the Sovereign Wealth Fund, I was directly involved and responsible for building the cancer center in Lut. Part of the things we need to do is this frequent testing. Breast cancer, cervical cancer, and all of these cancers. I think the cost of even going to hospital when you're sick is so high. When you're not sick, you don't want to go there. But people should frequently go for checkups. So maybe part of what we build into the insurance scheme is the ability for people once a year to go for checkups. Many Western countries, when a girl child is born, there's certain vaccinations they get that's preventive of certain kinds of cancer. And we must be able to provide it for our own girl child. So we look at things like this. And I'm sorry that you have had to go through this experience and personal loss, but we will do our very best in Edo State. For you nurses, and I say it all over again, nurses, they are probably the highest paid medical workers, particularly in America. I have seen doctors change skill to become nurses. I have seen lawyers become nurses. And I know that the temptation for you to run away is high. But please, we need you here. I know it's difficult, the security situation, the cost of living, but we really need you guys here. I was so unhappy when I was talking to the girls and the boys in the School of Nursing. All of them said they were just waiting to graduate. Please, we need you guys here. We'll do everything possible to keep doctors, to keep nurses, to keep healthcare workers. If our own people are not healthy, we cannot build a strong economy. And so we will do our best, okay? One of the things I've said here today is that we will encourage our specialist hospitals to be truly specialist hospitals with the personnel and equipment to train. And those doctors who are house officers, who are registrars, even consultants, will do our best to provide residence for them. Definitely, we'll provide residence for doctors in rural areas. Definitely. So that we can kind of make it attractive for them to stay in the rural areas. We provide residences that have Wi-Fi and electricity. But we will look at this residence issue because it solves many problems. Again, we come back to this issue of revenue and capital. We must increase our revenue base. 15 billion a month is certainly not enough. It's not enough. Even with the best intention in the world, with the best maintainer of capital and resources, 15 billion doesn't go a long way. So what we all must do is build an economy that enables us to have a revenue base of 100 billion. But I'd truly like to thank everybody because I've learned a lot. I've taken notes. My guys here with me have taken notes. And most of the things I've picked up from here will help us as we formulate our policies for the healthcare sector.
There's a lot of reposition in terms of knowledge, in terms of resources, in terms of documents, that all simply the state requires, like Nigeria, is to dust a lot of these documents and put them to a point of realization. Therefore, I want to say, sir, that part of the challenge plaguing healthcare all over the world has to be with how to attain universal health coverage. It is critical. I just came back from Chicago. I've been to over 50 countries, and I can tell you the real argument is how to get people, at least within the healthcare arrangement, access to quality care. Therefore, it's not just in terms of the cash area, with due respect, it's also the content and the quality of the benefit package. A lot of the health insurance schemes we have in Nigeria, with due respect, do not offer that level of quality. I go to Rwanda, for instance. You have any kind of medical condition, even surgeries, you can walk in straight away and have your surgeries. Nobody's going to be talking about co-payments percentage payments and all of that, which even the ordinary citizen cannot afford. So my wish is that we're able to recreate that kind of concept in a way that delivers not only access, but quality access, so that Nigerians and indeed Edo State citizens can have a lot to, of course, revert for the program. If you become governor, Mr. Asue Ighodalo, and that is just to say that in addition to the 50% which are committed to, how do you encourage that level of facility, managerial responsibility, where people really now know that, yes, you put me in charge of Obasanjo, I'm really in charge of that Obasanjo. We talk about UBTH, for instance. UBTH has some capacities and competencies, and in fact have available resources to them. But can same be said about the MD of Central Hospital, the MD of Stella Obasanjo, or even the zonal directors? So these are some conceptual issues that perhaps need to be grappled with to revitalize healthcare arrangements within those facility spaces. I particularly am enthralled today. Your commitment alone to give 15% of the budget of Edo State to health will be very historic. So I want to thank you for making that commitment and committing yourself to the welfare and the prosperity of the doctors and other health workers in Edo State.
I'm impressed by your knowledge that you covered everything, many things here. Like somebody who has gone out, who has been going out of the country, and you studied many of the answers you gave are things that happen abroad. And I must say that it's very unfortunate that I came to the UBTH in 1982 as a consultant and senior lecturer, and the health system in the country is worse than it used to be. And that's very unfortunate. Tuberculosis, children under 10 years, all these were treated free of charge. We had a nutrition unit that was unfortunately destroyed here, and no new one has come. All we are thinking of is revenue, collecting money from private doctors, and that comes with the taxation issue. This will give rebates to people who have clinics in the rural areas, who have this, and that's why I want to mention all this. I don't know why we should not have that again. If we had it in 82, why we should not have it in 2024? It's very sad that the private doctors will be running up and down, that around the CMD of UBTH will be locked up if he doesn't pay the tax. These were things that happened. And I don't see why that should be happening again. So that is very important, sir. And then we talked about roads, we talked about all this. Unfortunately, I don't have the picture of my road here. I'm over 80. So when you talk of the health care, I think I'm one of those to be considered. So I cannot come out of my road, 19th Street, sir. When they started doing that road, opposite here, sometimes towards the end of last year, I was very happy. Because all governors have come there and promised to do the road. And when they started at the end of 2023, I said, anybody who does it, I'm going to vote for the first one. But it's lasting 9 months. I had to leave the country because I cannot come out of my road. Up till now, all the people around those who have shops, their shops have been closed. Where is the money now to take care of them? When they are not working for over 6-7 months, I don't know when they will complete that road. So I think one of the things, you give a job to any contractor, there must be timeline when he finishes.
I've taken all your comments and valid. This issue of cupboards have documents that have gathered dust. We don't need to reinvent the wheel. I agree with you 150%. For some reason, new governments come up and want to do the same thing all over again. I promise you that I will not reinvent the wheel. I will not waste government resources on reinventing the wheel. I promise you. Also, maintenance culture. We need to do something about it. And that is the problem. I don't know, everybody likes high projects, high value projects for their own reasons, and we refuse to make. When I was growing up, there were all these public work departments that maintain roads, maintain buildings, maintain things. So we have to go back to that, it's teaching in time stage 9. And we have to truly go back to that. Supervision is key. We talk about giving authority to the head of these departments. One thing, sir, we must choose competent people to head, and then we must give them the resources and the capability to perform. Again, when we're growing up, medical directors of medical institutions were first-class medical minds and first-class administrators. So that's why we had hospitals that were reference hospitals to other hospitals in the world. And it's not because he's sitting down here. I think Professor Baseki has done very well in UBTH. And I'm thinking that if we have quality people that are fit for purpose, round pegs in round holes, what you say will happen. We will give them the authority and we'll give them the resources, and we will build first-class institutions. Our professionals must be professionally arrogant. And what I mean by that is this: you must be able to work such that if your work is looked at anywhere in the world, it will be given an A star. Period. So I thank you for your comments, sir, and I take them all on board. Prof. Abiodun, I can't add anything to what you said, sir. I take your rebuke in good form. I take your advice in good form. You at 80, after your service to this country, should not be subjected to trekking long distances to be able to access your car. It's not acceptable. It's not. All I can say is that even now, I will inquire from those in government whether the road hasn't been dealt with. And if I can do anything by letting them, I will. But if by the grace of God I become governor of the state, I promise you I'll fix the road if it's not yet been